Everybody, and welcome back to another episode of our Positively Connected in Dogs. Today we have a very special guest who's going to talk to us a little bit about our senior dogs. And this information is valuable for you even if you don't have a senior dog yet, because there's a lot of different changes that we have to make in order for us to care for them properly. So before we get started on our topic, do you mind introducing yourself to all of our viewers?
Yeah. Thank you for having me. First of all, I'm really excited about this topic. My name is Claire, and I am a veterinary nurse. I've been a veterinary nurse for over 10 years. And in 2015, I opened my own practice for animal massage. So we've been offering, my business partner and I have been offering animal massage, laser therapy, PEMF therapy, heated stones. We, in 2020, added on veterinary nurse needs at home. So, blood pressures, blood work, nail trims, clip and cleans, all of that jazz. 95% of our practice, I would say, is senior animals. So this is definitely an area that's really near and dear to my heart. We do a lot of hospice and palliative care. We've networked with a veterinary clinic here in where I live in Lyons, Colorado, for their hospice program. So we help facilitate some of that, and also are just now beginning to offer community classes at the Colorado School of Animal Massage to help empower pet parents with using that modality between other services and other professional bodywork sessions. And then I help manage a veterinary practice here, an integrative house call veterinary practice. I'm super lucky to have been doing that for about 8 years now as well. So
I love that. Now, if anybody tuning in has any questions for Claire as we are going through, remember that you can always drop those in the comments and we'll get to them before the session ends. So obviously with our senior dogs, as they start to age, dogs will go through different changes, right? So talk to us about some of the changes that people might see as their dog starts to age.
yeah, so the first thing I'd like to touch on is just that going into this, really age isn't a disease. So even once your dog hits a certain age, if that's what's considered senior for them based off of their breed or weight or anything like that, doesn't necessarily mean they're any less healthy. But of course, as we all age, certain ailments are more common, they're more relevant. We need a little bit more check-ins, and certainly there are conditions that become more common as we as an animal ages. So remind me your question.
Yeah, so what are some of those changes that we see as our dogs age?
Yeah, so we can see some cognitive dysfunction. We can see definitely age-related arthritis, osteoarthritis, spondylosis, which is arthritis of the back. In that, we can see compensatory issues. So they might, let's say, have sore hips or a sore back end. Then we're seeing them offload to the front end, and now they've got some neck issues or some forelimb and shoulder pain. We can see, vision, the senses kind of become impaired a bit. So a lot of the times they'll get something called lenticular sclerosis, which is where they just can't see as well in the dark, or maybe they're going blind in general, can't hear as well. So all of these things combined, as we see these things sort of develop, allows us to really reflect and change the way we approach our senior animals. Those are probably the most common things we see. Of course, there's neoplasia, cancer, and other more significant diseases, or what we'd consider more significant.
I'm really glad that you brought up that age isn't a disease. I think that can be intimidating to people and sad for us to see our dogs start to change as they do get older.
Yeah.
But it's just another stage of their life that we have to then adapt with them. In our house right now, we've actually got an older household. I've got a 7-year-old and a 10-year-old, but they're still out going backpacking with us and hiking and biking. And, we change maybe some of the intensity or change how we're doing things, but it doesn't mean that they have to stop doing things. And in fact, that motion is essential as they age. We need to keep their bodies moving. We need to keep that muscle tone on them, because as they do age, we can start to see some muscle atrophy in them.
Definitely. Yeah. And, as the process continues and they do enter into palliative care, hospice care, things get a little bit more sort of iffy with where they're at. It's just this beautiful process to witness in a pet parent because it's extremely profound. I mean, you just experience all these levels of grief even preemptively, and so there's just so much there's just so much there. It's so complex, even just from like a heart-centered place in a person, you know. Um,
Yeah.
so there's
No,
just a lot of variations of that age, as they
right.
go.
Right, absolutely. Now, one of the things that's really important for, of course, all dogs, but definitely our senior dogs, is keeping them at a healthy weight. And as they start to age, maybe if they're getting a little less exercise, we can start to see that metabolism slow down a little bit. So talk to us a little bit about kind of some tips on how people can keep those dogs at a healthy weight without necessarily, saying my dog needs to lose weight, I'm going to go take them out running, because that might not always be the best thing to do with our seniors.
Yeah, definitely. I mean, I think it's like anything, it's so individualized based off of that animal and where they're at. Um, you know, Certainly one of the most direct things I think of is diet and, substituting certain treats for others, maybe using veggies in replacement for a carb heavy treat. And then really modifying their mobility and their exercise routine based off of where they're at. So like you said, if just because they're a senior doesn't mean they can't go on that hike, or maybe they can really only go on a walk, but that's a short walk 3 times a day. Or maybe it's a dog that loves swimming, and so you can incorporate some hydrotherapy in. But I agree with you, movement is really essential for keeping the blood circulating and nutrients to those muscles and reducing that atrophy and wasting, and also from that exercise component. And then from a mental stimulation of
Mm-hmm.
just being a dog. But really, those are probably the easiest approaches, is really kind of modifying an animal's diet based off of, yeah, how many calories are they exerting every day, really? Is that changing for a senior dog during the winter months if we live in snowy areas? um, it's something you can really work with your team on as well, like getting that veterinarian's input or getting that trainer's input on, how do we modify treat intake when we're training, or, all of those different, considerations.
Yeah. I'm glad you brought up that mental component too, because, along with aging can come some cognitive changes in our dogs. And keeping them active mentally is so important for them. Keeping up with the training routine, keeping up with, enrichment, getting to sniff, getting to go places, can be so helpful for our dogs as they do start to age. What are some other activities that you like to incorporate or encourage clients who do have those older dogs to be active?
Yeah, I mean, that's a really good question. So specifically encouraging them to be active.
And I apologize. My dog decided to pick up a squeaky toy right next to me. So if you hear that in the background, that would be Lennon. But yeah, what kind of activities do you try to get people doing with their senior dogs? Maybe even senior dogs that are starting to have some of those mobility issues.
Yeah, I mean, I think the easiest thing is really just to keep up on the walks. I mean, that's like the easiest thing I think of when I'm thinking about how to keep an animal mobile. There's a lot of ways you can assist with that. If they're having trouble walking, I have a client that has a 17-year-old dog, and he literally just, sometimes this dog is so geriatric that and painful that he can't go on walks on certain days. So he'll just literally throw a treat across the room or throw a toy or some incentive across the room just to get him to get a little bit of movement in.
Yeah.
And then there's, of course, manual movement, like incorporating some at-home basic massage techniques. I mean, massage is very aerobic, which is like getting the blood circulating. It's not something we tend to think of as being like walking or running, but it definitely is helping to move that blood and move all of the circulation through the body. And so that's a great option for dogs that are a lot more sedentary. Gentle range of motions, if you can have a veterinary professional or a rehab vet or a veterinary nurse kind of go over those passive range of motions, that's something you can do while you're just watching TV for 5 or 10 minutes at night. And these are really easy ways to incorporate the same results you would get from walking and running or hiking, but on an animal that isn't really capable of moving in that way anymore.
Yeah. Other things that come to my mind too, in terms of getting them moving a little bit and kind of stimulating their brain, is doing like scatter feeding out in the
Oh,
grass. Like
yeah,
go out your front door with them on a leash. They don't have to go very far. The treats can be close together or the food can be close together, but just giving them an opportunity to sniff and see distractions around them and kind of get some fresh air, or
sure.
sitting, on your back deck uh, on a bed with them and doing some of those range of motion activities. But I think that as our dogs age, we can see some people that will kind of not take that older dog outside anymore. They're kind of like, oh, well, he just wants to sleep or he just wants to be sedentary. But, keeping them up and moving and mentally sharp is kind of how we help them through this phase and make sure that they stay with us in a good capacity as long as possible.
Definitely. Yeah. Another easy approach is just some easy stretches, like cookie stretches with the neck, up, down, side to side. Um, that's really kind of inviting to them because they're like, oh, there's a treat. This is exciting. And I think the other component to this movement and getting them out and kind of getting creative and meeting them where they're at is also, it's really keeping the pet parent it's keeping that connection, it's keeping that bond. You're able to really, on a regular basis, reassess where your animal's at. Does that walking look different? Does it look different when they're trying to, find the treats in the snuffle mat or what, kind of really reassessing like how everything's going, because things change, right? Like in all of our animals and especially our seniors, things can change fast. And so it's just a great moment of connection, assessment, evaluation, and getting a pulse on where your animal's at.
Yeah, I love that. And I love that idea too of the gentle range of motion or the massage, because then you're getting your hands on your dog too. So you'll be able to feel if something doesn't feel right, or maybe you feel a little warmth or swelling, or your dog is normally okay with this exercise routine, but today they're not. And that might
Right.
let you know they're in a little more pain, because I find that things change quickly with any dog, but they change quicker in our seniors as they age. And so the earlier we can kind of find problems or address concerns, the better off the dog is going to be.
Definitely. And I think those things specifically, like the massage and the range of motion, they're a really nice kind of timeout and connection for the person too, or maybe time in. It's really easy. I see it all the time in my clients that have senior animals to just kind of fall into this place of overwhelm. Like, what do we need to do today? Where do we need to go today? What am I doing? Like, just to get into this spiral of
Mm-hmm.
all the things to do to keep your animal like where you want them to be, or your dog where you want them to be. It's so easy to kind of lose ourselves or where we're at in that process. And so I feel like not only is it great for all of those things that we mentioned, but um, it's just really great for making yourself a priority in the process too.
Yeah, I think so
And
too.
remembering what the most important thing is, which is that relationship, that connection.
Absolutely. Absolutely. So with our dogs, there's kind of proactive care that we can take, and then there's reactive care that we can take.
Mm,
Proactive being, I know my dog is increasing in age. They aren't yet showing signs of arthritis or muscle atrophy, but I want to make sure that doesn't happen. And then there's my dog is already showing signs of arthritis and discomfort. And now the goal is to kind of reduce inflammation and build muscle back up that we've lost. So talk to us a little bit about the differences in those two types of care and when you would recommend, one over the other.
that's interesting. Pull me back in if I go on a tangent or I'm not
Yeah.
enough. Okay. So, but I love that you mentioned the preactive care, because one thing that I'm really interested in, or that I think is really important, is a very integrative approach with every animal. And I think this goes a lot deeper than just having the veterinarian that you really love that is a traditional veterinarian that's a brick and mortar where you can go, and having the ER for if something is happening right now that you need to go tend to at 2 a.m. and having the rehab vet, it really gets it can get really nuanced. And I think that the more we can kind of check into that, the better. So I think the first thing I recommend is to really evaluate your pet's team. And that includes team members that we don't often think of, like, of course, trainers, but also, your pet sitter, your dog walker, your roommate, your dog, like all these pieces, because the more we can establish that team, the more support we have when we really are going through something, or something is now being seen like they do have arthritis or whatever diagnosis has happened. So that's the first preemptive step I would take. And it's also then your reactive, like it's also then the step you take when you're in the middle of it, because you've kind of created this network and now you can pull it in. You can pull in the people you need. And it's just more eyes on your animal. What behavior changes are happening? What subtle changes? Are they kind of gaining weight, but you're not seeing it? So it's just more eyes to have. There's a lot of things you can put into your toolbox or learn about beforehand that you can kind of just like pick at as you go. There's tons of supplements you can start any dog. If your dog's hit 10 years old but isn't showing any signs of arthritis or pain or disease or anything like that, there's plenty of glucosamine, fish oils. Those are the first two things that come to mind. And then there's plenty of pharmaceuticals that you can add on as you go. So I think it's important just to educate yourself, find that team, and be that advocate, and be comfortable kind of going with anything and everything. Don't just say no to some, just really ask questions.
Yeah,
Does
I
that
love
make sense?
that.
Yeah.
Absolutely. Yeah. I love the idea too of finding that team before you need them, because it can be really helpful for your team to have a baseline of what's normal before you start to see those changes. Then they know, okay, this is what it used to look like or feel like or be like, and now here's where we're seeing changes. And that might even give them more ideas on how they can help support your dog throughout that process.
Totally. And when you're in the process of getting a really scary diagnosis or something's really changed and you're in that overwhelm and fear, it's really not the best place to take those action steps, because you are reactive. And at that point, you need that team, and so it's a hard place to operate from in that way. And that's why, again, so important to, work on making that team prior.
Yeah. So you mentioned trying things, which I love, because there's a wide variety of, as you mentioned, supplements and medications and therapies that people can do, exercises people can do with their dogs to in both that, proactive and reactive care line. Can you talk to us in a little bit more detail about what some of those might be? And we could start kind of with the proactive stuff, like as people are getting that team involved and the dog isn't showing symptoms, what are some things that, that team might recommend?
Yeah, that's a really good question. And these are, I think, a lot of them are pretty standard and accepted in the veterinary world, and veterinarians are going to be like really on board. And so it's really nuanced, again, based off of that animal and their medical conditions and things like that. So I would just say, like, I'm not a vet, but, veterinarians will be great at really incorporating a lot of these things in and having lines that they feel really confident in. Again, glucosamine and fish oils are great for like every dog. I've had my dogs on them since they were just like 2 because they were active and crazy and large. So I knew, with those large breeds, we kind of have to be a little bit more cautious of their joints and things like that. So those are the very first 2 that come to mind. CBD is certainly very up and coming.
Oh,
Am I still here?
There you are. Yeah. Oh, hold on. Now you disappeared.
Okay.
There you go. Okay.
Okay.
So you were mentioning
Awesome.
CBD is up and coming.
So CBD's been really up and coming for a few years now. It's something that I think we think about a lot for specific conditions like seizures or arthritis, but there's a lot of, there's some information anyway that it's good for the immune system to begin with. So it can be an immune boosting supplement to use. Looking at diet, how you're feeding your animal, what you're feeding your animal, again, how that can help keep them at their ideal body weight. Um, are you feeding things that aren't aligning with like their gut health? And are there ways that you could add certain things like broth or, how can you look at how inflammatory the diet may be in general, no matter the animal's age? So I think those are a few things that come to mind.
And what about our treatments kind of after we're starting to see some changes in the dogs? I know at the beginning of this, you mentioned massage and laser
Yeah.
therapy. Talk to us in a little more detail about what those are and then how they benefit our dogs.
Yeah, there are a ton thereafter. So yeah, massage, laser therapy, acupuncture, chiropractic, rehabilitation, well, physical therapy, are the main ones that come to mind. They do so much. They can help with arthritis, range of motion, muscle tone, reducing pain, increasing quality of life. Repair, increasing healing time after surgeries, um, promoting blood flow, increasing the lymphatic circulation, which is something that's really important because the lymphatic circulation doesn't have a pump in the way that blood has the heart. So it needs movement. It needs something to get it going.
Mhm.
And so we can help that. And that's really important for our animals that are not moving as much and are more sedentary because they're not getting that. Um, these are, and the thing is about body work, there's so much and there's so many things you can add on once you get to this point. And every animal is different. So it's important to be open. And I think it's really important to remember that your dog is also a part of the team, right? So, like, we don't want to push a dog that hates massage onto them if they're more of a acupuncture dog, or we don't want to push acupuncture onto a dog that would much rather be having the manual work. But they're all great modalities for inflammation as well, reducing inflammation. Um, but there's like a million things we can do once we get to the point where things are needed.
So we've talked a little bit about physical stuff and we've kind of touched on that mental component, but that's a really big piece of the puzzle as well. And I know that as somebody who takes a more holistic approach and kind of a complete overview approach yourself, making sure that they're happy and healthy mentally is also super important. Can you
Yeah.
talk to us a little bit about what cognitive dysfunction is and what signs people might be seeing from their dogs?
Yeah, a lot of the times what people are seeing is almost just like an inability to identify kind of where they're at, or they're doing kind of peculiar things like waking up in the middle of the night and barking at random things, or just seeming more agitated in general, and that can be a really distressing um, thing to experience as a pet parent.
Mhm.
And it can be hard to know, like, what do I need to do? Do I need to add an anti-anxiety, a sedative on board, or
Mhm.
how do I approach this? It can also show up as dragging the back paws. That's something we see a lot in senior animals. That's called the conscious proprioception, and a lack or reduced of when they start to kind of drag that back paw.
Mhm.
Um, and then sort of incontinence in general. Sometimes they'll start to urinate or defecate without really knowing, maybe in their sleep. These are probably some of the most common ones.
And that can, as you mentioned, be really distressing on the owner too. And maybe some things they might be aware are related to age, but some things like an increase in anxiety or just changes of behavior can also
So
indicate that cognitive dysfunction and maybe not be quite as obvious to the owner. Medications, supplements, adaptyl pheromones, are these kind of the general route that a veterinarian would take for something like this?
yeah, yeah. And I think just also kind of cueing into where their senses are at and kind of, meeting them there too. If they're losing vision, then of course we want to kind of identify how we can help them through that, make them feel more comfortable. Maybe we're not, I mean, we probably wouldn't do this anyway, but running right up to them to pet them and, maybe we give them some subtle cues that we're coming, or we make some arrangements for helping them with the fact that they can't hear us as well. For the animals that are dragging or having that muscle weakness in the back, we can line the house with, yoga mats or really cheap rugs that we get at Marshall's or something, just to give them that extra traction so that they're not slipping. All of these kind of areas where they start to kind of like degenerate, like just kind of like lose, not have the same vision or same hearing or same function as they used to, is really anxiety inducing, and then these things where we see them slipping or falling, or that then is just kind of promoting more pain or anything like that. So I think just really identifying where they're sort of struggling and kind of probably incorporating some training modalities in, and training the pet parent really on how to kind of approach them to kind of, help them through that.
Yeah, I'm glad you brought up that kind of observation of behavior in the house, because whenever we want to modify or change behavior, we always want to observe the context in which it's happening.
Yeah.
So as you watch your senior dog and you're noticing these signs of behavior changes, take note of where they're happening. Are they happening the same time of day? Is it always happening after a nap or when they're in a deep sleep? Are they getting startled by people moving around them? And then figure out how you can rearrange your schedule or management in the home. Maybe an X pen around the napping senior to keep our child away while they sleep. There's different things that we can do from a management setup as well that will help keep that dog from hurting physically or mentally. And I'm really glad you brought up the runners or rugs around the floor, because that was actually going to be my next question for you, because there are some changes that we might need to make as our seniors do start losing that traction and losing that proprioceptive awareness. So obviously rugs and runners are good. We might consider putting a baby gate up to block access to stairs, maybe just certain times of the day to limit how much they're going up and down. Are there any other things that you can think of that you try to help your clients with in terms of like rearranging things in the house, or, blocking or adding in harnesses to help them?
Yeah, there are so many aspects of the environment that are so important. And I think that's one of those pieces with like approaching holistically that we really have to keep in mind. I'm sure as a trainer, you do all the time. The runners are some of the easiest ways if you have wooden floors, tile, linoleum, things where it's just harder to grip. A help them up harness. They're bulky, they're big, they're ugly, but they're really, really helpful, not only for the animal, but for the pet parent, helping that dog get up and down the stairs. I mean, some stairs are just unavoidable. Maybe you have 5 to get to the yard, or to get out of the house, ramps to get in and out of the car so they don't have to jump up or jump down. Little subtle things like maybe elevating a water and food bowl if your dog knowingly has shoulder and neck pain. Those are some of the big ones that come to mind. Maybe adding some stairs to get up and down off the bed or the couch. There are so many ways that we can modify an environment to really work in a senior dog's favor. And it's really about, like you said, observing, really looking, where is your dog struggling, right? Like, are they just really struggling to get down those stairs, but they have to potty, so they're pottying inside because they want to avoid that. Like, how can we just really watch and learn from them? because they're really good at telling
They
us.
are. They're great teachers. We just have to make sure that we're disconnected from our phones and TVs and screens and observing them. And if we can do that, then we can really learn a lot about those areas that they are struggling. And then, maybe if I'm unable to come up with a solution on my own, I've got that medical and supportive team behind us that I can say, okay, this is where my dog is struggling. This is when I notice it. What can we do to help this out? And then, you've got that sounding board to get those ideas bounced back.
Totally. Yeah. The other thing that comes to mind for some dogs are booties. Some dogs won't handle them well, but for the kiddos that are really just struggling with falling or slipping, they can be really helpful. Sort of the same concept as the yoga mats and extra traction.
Yeah. In terms of feet as well, making sure that we're keeping those nails at an appropriate length.
I have a list.
Yeah. We don't want to hear them ticking on the ground, because if they do, then their foot is not able to spread out and be used in the appropriate way. And then making sure that they don't have Grinch feet or Hobbit feet, trimming hairs on those longer breeds so that that pad can get traction when they are up and moving around is going to be important as well.
Totally. Yeah.
One other thing that comes to mind, and then I see we've got a question here that we can answer, is I guess more training, but I know that you and I had kind of had a chat already about training. So maybe you've got some ideas on this too, but as our dogs get older, their tolerance for different things can change. If they are physically uncomfortable, maybe they don't enjoy a bunch of petting from strangers. So kind of keeping an eye on that as well when you are going out and about with them, not being afraid to be your dog's advocate and say, oh, not today, we're not going to do that. Keeping kids away from your dog, kind of reducing any of those external stressors that we do have the ability to, so that our dogs aren't, that anxiety isn't increasing as we're still out enjoying the world.
Totally. Yeah. And as house call veterinary nurses, this is one area where we really thrive because we can bring our services to the animal. So instead of having them, go down the steps, jump in the car, jump out of the car, get on the scale, go in the room, we just come to them and we can help them. But I totally agree. And I believe strongly that a pet parent is the biggest advocate. And we have to just empower them as much as possible to really use that voice and feel comfortable using that voice.
Absolutely. So we've got a nice question here. We are wondering, thanks for the webinar, wondering if any mental stimulation can help slowing down the symptoms of cognitive dysfunction.
Oh, that's a great question. I think so. Absolutely. I mean, it's kind of like crossword puzzles for us, like keeping your brain sharp and keeping it going. I mean, not only is it just fun and keeps us happy, but I definitely think that it has huge benefit there. Absolutely.
Yeah. I think sniffing, still being able to get out and see the world, training new tricks, refreshing old tricks. Yeah, food puzzles, licky mats, bones, all of that to kind of help give them an activity. I always like to use the analogy too, like if you don't use it, you lose it, and that can be for a foreign language that you learn or muscles that you're working out at the gym. And it's the same thing for our dogs physically and mentally, that staying engaged in those activities will help keep all of those muscles strong, keep that brain working, keep the body strong so that they can kind of keep moving with us.
Definitely. It's all extremely interconnected.
Yeah. Well, before we head out, that was a nice question. Before we head out, is there anything else that we didn't talk about that you think is important to mention about our aging dogs?
Let's see here. I think, I had a list here and I feel like we really did a great job covering everything. Yeah. I think
I guess the one thing that I will repeat here for everyone still with us is get that team early, find your professionals, build those relationships, and let them start seeing your dogs sooner rather than later, because it's easier in my experience, and you can let me know if this is true or not, but in my experience, I've found that it's easier to keep things maintained than to let things kind of decrease in quality, or let those muscles atrophy and try to rebuild them again. It's easier to kind of maintain it and keep them strong. So getting that help earlier rather than later can be really beneficial for the dog.
Definitely. And by that point, you've already created those relationships are really important because you're putting a lot of trust into other people for your animal, with your animals. And so, if you are sort of interviewing veterinarians when you already need them, it's really difficult,
Yeah.
Maybe you are getting a diagnosis from a professional you don't really connect with. And it's much easier to go through the process when you have a team that you've already interviewed, you already love them, you already know that, your dog knows them. So there's so many benefits to that. And I would say that's one of the most important things to do.
Well, Claire, thank you so much for joining us today and talking about our senior dogs.
My pleasure.
It's hard to talk about, but it's so important to talk about because people need to know these things. And like we said, having that knowledge sooner rather than later and starting to build those relationships and build your skills as a dog owner to care for them with all of these additional therapies is going to be helpful.
Totally. Yeah. And care for yourself during the process.
Absolutely. Self-care is always important. All right,
Awesome.
everybody. Thank you, Claire, and have a great day, everybody.
Okay. Bye.